Good afternoon. Thank you so much for coming to today's Speaker Spotlight program, where we're going to look at multilingual health information resources. My name is Darlene Caskey, and I'm the Community Engagement Coordinator for Region 6 of the network of the National Library of Medicine. We have a few items to cover before we get started. All attendees have been muted, but we do welcome your questions and comments in the chat at any time. Miles Dietz-Castell is behind the scenes. He's Region 6 Communications and Finance Coordinator, and he is providing the technical assistance with me today, and he'll be helping keep an eye on the chat box. And please be sure to select everyone from the drop-down menu when you post your questions so that everybody can see the questions that are being asked. And that will ensure that we, Miles and I, see them as well. We'll queue them up as they come in and save them for our speakers to address at the end of our presentation. Closed caption has been enabled, and it's available by clicking on the icon with the 3 dots and then selecting closed caption. Please know we're recording today's session, and we'll post it on NNLM's YouTube channel in 1 or 2 weeks. And at that time, everyone who has registered for this session will receive an email from us with the link for the recording. This class is also eligible for 1 Medical Library Association continuing education credit, which you'll be able to claim through the evaluation link and the enrollment code that we share at the very end of this session. And speaking of the evaluation, we really do appreciate your feedback. It matters to us, and it helps us improve our trainings. So do take a minute to complete it. Now, since some of you might be first-time attendees to one of our webinars, I'd like to share a few words about who we are. NLM is the National Library of Medicine. It's one of the 27 institutes and offices of the National Institute of Health. It is the world's largest biomedical library, and it produces online resources like PubMed and Medline Plus. NNLM, or the Network of the National Library of Medicine, is the outreach program of NLM. We work to ensure that health professionals and the public have equal access to health information. NNLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, and they all provide training, funding, and engagement opportunities to over 9,000 NNLM member organizations. Region 6 includes the states of Iowa, Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. And if you would like to connect with any of your regional medical libraries or learn more about us, you can check out our website at nnlm.gov. Today's session was organized by Region 6 as part of our Speaker Spotlight series. This series features expert guest speakers presenting on topics of interest to all users, which include librarians, public health professionals, educators, clinicians, and others who work with health information. And you can learn more about our upcoming sessions by subscribing to our Region 6 newsletter, checking out our blog, or by following us on Facebook or Twitter. And now, our 2 speakers today. They both applied and received the Region 6 Health Information Outreach Award of up to $20,000 to develop multilingual and multicultural resources for their communities. Their projects tie to the NNLM mission to advance access, use, and understanding of health information for everyone to make informed decisions about their health. Each speaker will spend 10 or 15 minutes telling you about their organizations and their projects. Then we'll have the Q&A with both speakers, as well as an added surprise. So don't leave. So we will start with Jeff Klinger. He is the president and CEO of the Central Ohio Hospital Council located in Columbus, Ohio. He reports directly to the organization's board of trustees, comprised of the CEOs of Franklin County's 4 hospital systems. And he collaborates with them on a regular basis to define association objectives. He's also the liaison between the organization, the community, and business leaders, and other local constituency groups. So in May 2022, the Central Ohio Hospital Council applied and received funding to develop patient educational materials in collaboration with those 4 area hospital systems. The patient education materials are available from a website called Health Information Translations, and Miles will add that URL in our chat box. Health Information Translations is an open website for information translated into multiple languages for predominantly limited English proficiency populations. And that's all I'm going to say, because I'm going to turn the program over to Jeff to tell you more.
Thank you, Darlene, very much. I'm going to pull up a slide deck here, hopefully, to share with you all. Good afternoon, everyone. Again, so my name is Jeff Klingler with the Central Ohio Hospital Council. As Darlene mentioned, my role is to work with the CEOs of our 4 hospital systems here in Central Ohio. And the purpose of the council really is collaboration. I look for opportunities for these 4 competing hospital systems to work together. And so we do a lot of work in the community around infant mortality, opiate addiction, overdose deaths, overdoses, behavioral health. We do a joint needs assessment. And under our diversity bucket, we do have an initiative I want to talk to you about today, Health Information Translations. This is an initiative that's been around since 2004, when the patient education representatives of the 4 hospital systems came together and said, listen, we're really spending a lot of time individually within our systems translating patient education materials into the languages that are needed here in Central Ohio. And we're really duplicating efforts, which is very, very costly. And is there really a way we can come together and do this collectively, do it jointly to keep up with the demand and the changing trends that we're seeing here in Central Ohio? So again, the 4 hospital systems, Nationwide Children's, Mount Carmel, Ohio Health, and OSU Wexner, went live with a website in 2005, Health Information Translations. I think Miles has put the actual URL in the chat. Healthinfotranslations.org is the URL of the website. And again, this went live in 2005, and it has grown certainly over the past many years. Just in terms of the number of documents that we need translated here in Central Ohio and the number of languages that we're seeing grow here in the community. I've got a sample of what you would expect to see on the website over on the right-hand side there. This is the high blood pressure document, high blood pressure during pregnancy document translated into Arabic. And I pull this up because I want to make it known that these documents are really intended to be used by clinicians. When they are communicating with their patients on a specific healthcare condition, these materials are designed for that purpose. But with that said, they're available to anybody really in the world, free of charge. There's no registration, there's no login, there's no password. And all these materials are available free of charge to anybody who would like to access them. I put this document up on your screen just to give you an idea about how all the documents are translated on the site. Again, thinking that they are to be used by clinicians, perhaps with a family member in the room or an individual that does have limited English speaking skills. We translate all documents in a side-by-side column with the English on the left and then the language we're translating into on the right-hand side. We think that really allows the clinician to kind of go through these documents with the patient, with family members, with other advocates as they're working with that patient on their healthcare need. We feel that the way we do our translation services is really the gold standard. This is really from the National Library of Medicine, considers our methodology to be a gold standard. We use a three-step process. Is that we have the document sent out to the translation services. They translate that document into the language. This is Arabic that we just looked at. A second speaker in that same language will translate the document back into English. And then we compare the original document with the second document translated back into English to see if we've missed anything. Now that's very costly, but we think it really is the right way to translate these documents and make sure that we're really getting it right for the community. So, it's a lengthy process and it's an expensive process, but I'm sure as our next speaker will tell you, it really is kind of the gold standard for the way that documents are presented on our website. The site has grown quite a bit over the years. We are about 8,000 visits per month, actively going to the website to search for documents that are contained on the site. About 65% of those users are within the United States, but interestingly, about 35% of our users do come from outside the United States. Top countries you can see there: Japan, Egypt, Saudi Arabia. And then, of course, we also, besides the 4 hospital systems here in Central Ohio, we have a number of healthcare providers around the country that are our top users of the website. HCA, Trinity, Mayo Clinic, Kaiser Foundation, Cleveland Clinic. You can see the list there on the right. So again, the website has really grown not only in the number of materials that we're providing to our community, but by the number of individuals and the number of organizations that are regular users of the site itself. So in terms of what's available, we currently have 374 titles that are accessible on the Health Information Translations website. Each of those documents are translated in up to 14 languages. Most are at 14, but there are a couple of issues where they might be only in 11 or 12 languages, depending on need, resources available at the time of translation, and things like that. So altogether, we have almost 3,600 documents actually on the website. I won't go through all of them, but you can see the primary languages over there in the right-hand column that we translate our documents into. Again, these are the languages that are most in need here in Central Ohio. We do get requests for some times. There's actually a contact button on the website where folks do reach out to us and say, hey, can you translate a certain document into a certain language? The website really is intended to meet the needs of Central Ohio, but certainly we think it's important to make that available free of charge to communities around the country. So again, in terms of what's available on the site, we separate the materials into individual health topics. You can see there on the left-hand side those topics that we divide our materials into: health and wellness, pregnancy and baby care, safety, prep and post-op instructions for various types of surgeries. And the blue box there is actually on the landing page in terms of how folks search for the topics themselves. As Darlene said, that we were very fortunate to receive funding from the Network of National Library of Medicine back in May, and we used those funds to either add or update 131 titles we added to the website. You can see the health topics there over on the left-hand side. Allergies, preventing falls, diabetes, weight management, information on dementia. We used our funds to translate these documents, and the funds went directly towards translation costs. The clinicians who work in our hospital systems in these various areas actually provide the materials themselves pro bono, doing the review of the documents, making sure that the materials are updated using most current best practices. That's all done pro bono by the clinicians that work in our hospital systems. So that is a quick overview of our initiative. I just want to take just a quick opportunity to thank the network for providing the funding. As you all know, I'm sure that grant funding is typically plentiful for new initiatives. But as initiatives go on, it is hard to find grant funding. So when we're able to get some funds such as what we received here, they really do go far, and they really do allow us to continue to build the website, to continue to build the content, and to provide these sources to not only our community, but communities around the country free of charge. So we appreciate it, and I'll stop there. And it sounds like we're going to take questions, perhaps at the end of the next presentation.
Thank you, Jeff. And we appreciate you. It does take some effort to write. I won't say a lot. Take some effort to write a proposal and qualify. So thank you for taking the initiative. And please be sure to visit the Health Information Translations website. As he mentioned, it's publicly available, it's free, and you can download any of those titles in any of those languages. So please check that out. Now, our next two speakers are from TPT Now, a dedicated health, safety, and emergency response broadcast and streaming service of the Twin Cities Public Broadcasting Service. Their programming is done in collaboration with community public safety partners, pair messages in multiple languages, including English, Hmong, Somali, and Spanish. Lillian McDonald is the Senior Managing Director. She was recognized for her outstanding public service during the COVID-19 pandemic. TPT Now and its Cultural Media Hub broadcast 28 press conferences in real time, supporting updates from Governor Tim Walz and the Minnesota Department of Health. Now, before her work at TPT, Lillian was the founding executive director of a nonprofit specializing in multilingual and multimedia programs and a broadcast journalist for radio and television stations. Yeah, she could speak better than I would. Journalist for radio and television stations in the Midwest, including WHO Radio in Iowa, Care 11, and Fox 9 in Minneapolis. She has also served as a public information officer for FEMA. And with Lillian is Sydney Gisvold, social media and content coordinator for TPT Now. She's responsible for their graphics and video content for social media and broadcast. And she also collaborates with cultural media partners, government agencies, and weather agencies to create and distribute health, safety, weather, and emergency content in English, Spanish, Hmong, and Somali. Prior to TPT, she spent several years working with diverse communities across Minnesota, North Dakota, and Norway through organizations such as the Concordia Language Villages. She's passionate about helping cultural communities achieve their needs through media and collaboration. We are looking forward to hearing about your project, Lillian and Sydney.
Thanks very much, Darlene. Thanks everybody for attending today. We're really grateful to have an opportunity to share our work. We're excited about the mission of our work and every project we do. I also want to thank our other presenter today, Jeff. Having spent some time in Ohio, you have 100% support here with your growing Somali and other populations there in the Columbus and Cleveland areas. We've actually supported some different agencies out there in Ohio too, and it's just amazing what kind of growth you've had out there in Ohio. And I'm sure many folks are dealing with the increasing diverse communities popping up all across the country. And that's actually part of the service that we provide in a variety of different ways. We'll just start first with a little bit about our organization. So we're a television station, and we are Twin Cities PBS. We're one of 6 PBS stations in the state of Minnesota. We're the biggest PBS station housed in the Twin Cities area. We have 5 television channels and several streams. Channel 2.5 is the TPT Now channel. It's a dedicated service with information only in the areas of health, safety, and emergency response. This work started in 2004, actually, when we got together with cultural communities to talk about what is the best way to reach you with vital preparedness and then emergency health and safety information. And so we actually engaged communities back then, worked with them on some ideas and concepts, and launched back then a nonprofit, and for 10 years produced I will say long play formats compared to today's technology in multiple languages, as many as 12 different languages. So they were kind of sit down documentary programs on health and safety topics. We merged with Twin Cities PBS in 2015 to dedicate a full-time channel to this service. It's over the air. It reaches 1 million households in the densest areas of Minnesota, where a lot of limited English proficiency populations reside. We have actually over 300 dialects in the Twin Cities area, and we can't support every single one of those dialects. It is costly. So instead, what we do is we bring together key leaders from the communities. We ask them for advice on not only communication strategies, but some language compromises that we can make so that we can reach more people. For instance, there may be several dialects in the Spanish language, but there's mostly Mexicans in Minnesota, and as a result, we work in those primary dialects. So we make a lot of these decisions based on keeping track of current demographics, where people are coming and going, and what it is they're doing and how they want to receive information. This is a 24/7, 365 days out of the year broadcast automated television channel. It's not only on television, but we also stream it. You'll see the live stream link there. Whatever's on television is actually what's also going out on our stream. Next slide, please. Essentially, this is what it looks like in the upper right-hand corner. This is a static shot of, again, the automated television channel. So our programming, we run about between 9,000 and 10,000 pieces of content on the air every single day. Graphics, videos, RSS data feeds, weather content, news tickers, and then music. And then we also have the capability, when there are warning and alerts that are coded by alert originators, like emergency managers or the weather service, we actually have built a facility so that we can, through those codes, create a drop-down menu of text and audio formats in 4 different languages. It's fairly new technology. We're the only broadcast station in the country that's been able to provide more than just English and Spanish when it comes to a tornado alert, for instance, or a flood alert, which we're looking forward to here in Minnesota any day now. The slide below is a network of partners that we work with. We started this work more than a decade ago, trying to get everybody to come over to our channel. And instead, we realized that if we partner with community and cultural media outlets, that we can actually reach our audiences better because they're watching, let's say, Somali content all day on a variety of topics. So we incentivize some of our cultural media partners who work with us sometimes to produce media content, and then they will distribute alongside TPT's PBS logo and hit 70,000 Somali audiences here in Minnesota, or Univision Minnesota, reaching more than that, or Hmong TV. And so we work with a lot of cultural media to help distribute and hit the target. And that also helps us with metrics, because we can find out who's watching, how many are watching, what's resonating. Now, the beauty of this is it's a partnership. Public media is a trusted media resource. It's even been surveyed that people tend to trust public media over commercial media when it comes to getting vital information. We're an education station. We don't run commercials. We don't try to, what I call, sex up the content to get you to watch. It's pretty much very pure content that we're doing with public officials and nonprofits in the area of health and safety with a single mission, and that's to provide a capability so more Minnesotans get the information. They get the information before a crisis, during a crisis, and after a crisis. Next slide. For this project, we had an opportunity to create more awareness and drive audiences to particular resources on a set of 5 priority health concerns for each of the communities. So we went to each of our 4 communities and we asked them, what are the priority topics? And we generated a pretty lengthy list, but we had to narrow it down to 5. Our grant award up to $20,000 also limits the amount of videos we could create, but we were able to do a set of video topics for 5 different topics, and also a set of graphics for the African American community, Hmong community, Latine community, and Somali communities. And we essentially, again, use our same engagement strategies to actually select the topics, develop the content, and then distribute it through our media partners. And we worked with community leaders specifically. It's not me, it's not Sydney, it's not anybody else at PBS on television. It's actually community leaders that are recognized by residents here in the state of Minnesota. and respected. And we work with them to do the finished products so that their voices are lifted and their faces are seen and their messages are more believable. In the end, we finished 20 videos, 40 graphics that ran on broadcast and social media campaigns and are still running actually through the month of April. Now, this is a shot of one of our community leaders in action. This is Pastor Anthony Galloway's fantastic. And again, a dynamic, great speaker, well-known in the community. And that sort of lends itself a level of credibility, frankly, that most of our communities, all communities, are more likely to listen to or watch than they are, no offense to any government leaders who may be on the webinar today. But that's just, we recruited from a network. These were some folks that were already in our fold. Other folks name dropped for us. And then, you know, community leaders are visible, right? So we recruited them, we did compensate them for their time, and we work with them to develop the content and present the content. We wanted to be visible. We wanted to use visuals that were impactful. And we wanted to work with active community leaders. We chose young and old, men and women, faith-based, business owners, and other influencers. There might have been a social media influencer to reach a particular group of folks. These are the topics that we were able to engage communities with in the content development. Addiction, depression, domestic abuse, healthy living, and mental health. A point about mental health, it comes up almost every single project we do. I feel like we can never do enough around mental health. And then in the course of that, so that's sort of a general mental health. What do you do if you suspect you might not be feeling as well as you'd like to, or you normally do, or if people notice it? So that's a general message. But then we were able to drill down into some more specifics. It's also important to note that we try to drill down to what the communities want to see and hear. Depression, for one culture may not look the same in another culture. There's a big taboo about talking about some of these topics in most of the cultures, and nobody goes to government because it's just not a safe place to go. They're afraid of things like being deported, for instance. So we have to kind of hit all those messages in one way or the other across the campaign. Our graphics had multiple versions. Thanks to Sydney's work, frankly, she was able to animate some things. Well, I shouldn't say animate, but she was able to illustrate some things, and she'll tell more about that. We also used standard video products, again, just to make them interesting and kind of draw people in. Customized for each culture is really the key. We really believe in that. And then distribution is also customized, quite frankly. With the community media entities we work with, they have the privilege of creating their own messages to display our content through social media and their broadcast platforms as well. Well, without further ado, City's going to do a little show and tell here so you can kind of see what the work looked like.
Thank you, Lillian. So, as mentioned before, we created 40 graphics and 20 videos. Half of those graphics were illustrated, while the other half had more picturesque images on them. And with each video, of course, we made sure to customize the topics for each cultural media partner. The dimensions for the graphics that we chose are meant to not only display on social media platforms, but also on broadcast. And these graphics are distributed to our partners and also distributed on our platforms as well. We distribute these through Facebook, Twitter, Instagram, and Google platforms. For videos, we have been running those on broadcast and social media, and are currently, if you're in the Minnesota area or even the Iowa and Wisconsin area, you might find yourself coming across one of our videos through an ad platform. So one of the things, what I'll be showing you right here is an example of Help for Depression. We translated this into Spanish, Hmong, and Somali, along with the other 5 topics. And then I'll also be showing an example here of what one of our videos looked like. So this next video I'll be showing you is actually our example of depression in English.
It's natural to feel overwhelmed when you're new to Minnesota. Moving, learning a new language, obtaining legal status, starting a new job or school can be stressful. You may be experiencing depression if you feel anxious or sad for long periods of time, or are tired with no desire to do everyday activities. Depression is treatable. Talk to your healthcare provider. Learn more about depression at medlineplus.gov.
Yeah, so these videos ran or have been translated into Spanish, Mon, and Somali as well, along with the text that is featured on the videos. So if the video is made for a Somali audience, we make sure that those depression symptoms are translated into the Somali language. And we also have those, and right now we currently have those distributing with our cultural media partners. Somali TV is one of our partners that is distributing Somali videos. Mon TV is distributing the Mon videos, and then our Spanish videos are being distributed on Univision Minnesota. And we are collecting metrics on this project right now. And so far we have cumulative impressions are 320,000 impressions on broadcast and social media. Univision Minnesota is running these videos on broadcast. Mon TV and Somali TV are broadcast and stream. And then we are running these on broadcast as well, but our metrics that we have displayed in this cumulative total is from our social media outreach, both through organic reach and through paid advertising. So right now, our best performing video and graphic is actually on Mon TV is for depression, with the total impressions of 5,741 and reach of 5,496. That topic is heavily resonating on that particular platform. And once again, we're not finished with collecting these metrics. We'll be running paid advertisements and also organic posts till the end of April.
Fantastic. Thanks, Sydney. As Sydney mentioned, the campaign runs through April. Campaigns are really important for two reasons. One, you put a little money behind it. We try to place the campaigns next to headlines of topics that each community is reading or interested in. So we can kind of tell when we're monitoring social media what's hot and what's not. And that's where we try to place content. We had a very small budget for the ad campaign, if you will, on this particular project. Media is not cheap to produce. And just as Jeff had alluded to earlier, reverse translations and basic translations and then getting more people involved is always costly. So we are very grateful. Like Jeff, being an established organization, there's kind of an expectation that we're just going to be able to produce content all the time. We're constantly looking for support and funding. What we like about these particular topics and this particular project is the content is timely and ongoing. Things do change, but we tried to be judicious in how we selected some topics so that we could get some legs out of them, if you will. We could probably have this content on for the next 3 years and it's still going to be current. Unlike a child safety seats content, frankly, that we did for another project. And when the laws in Minnesota changed on child safety seats, we're still waiting for funding to redo those programs. And they're used in clinics, schools, and of course, consumers at home. So it's just the nature of nonprofit work. I'm sure there's plenty of folks on this call that have the same interest. Sydney, I'd like to engage you to putting the TPT Now YouTube link into the chat, please, because we have dozens of topics. It's not just for use in Minnesota. A lot of this practical information is very valuable for folks in any state. We do get folks downloading and using and reusing and resharing stuff from other cities, states, even countries. So please, by all means, our mission is to inform as many people as possible. These are not Minnesota specific topics. You can find more topics on our YouTube link. And by all means, our webpage is housing additional information. The stream that you see here, timely and ongoing, this is a live stream link. It is not a link to our website. Our website alone, Sydney, if I could ask you to type that in, I don't want to try to type and talk. I know I'll make a mistake. But bottom line is some more information on our website, which you can actually go to our live stream from there as well, is available in the chat. And with that, once again, I thank this group for watching and taking an interest in our growing diverse populations. Words matter in all languages, and we need to continue the best practices and engagement strategies to invite people to be part of health and safety content. I'm just grateful to be here as well.
Thank you, Lillian, Sydney. We're very grateful to you as well for reaching out to us. You share our mission and have done some great work here. And like you reached out to all the other different partners and their different communities and broadcasting social media sites, we too are very happy to be able to bring this information to our members and widen the distribution of the materials you created. Because these are funded by the National Library of Medicine, we're a federal government agency. Any materials that are created for us with federal dollars are to be openly available to anybody. So I am very pleased to mention that through the help of Miles and Jacqueline Leskovic, one of our community coordinators, they spent many hours downloading the files from TPT now, and we've made it available on our website. So you can come here and also download those infographics. And Miles, would you like to share and show the website to our users?
Yes, thank you, Darlene. Let me share my screen real quick. All right, can you see that?
I cannot. So maybe I can stop sharing.
Let me try this one.
Now I can, yes.
Okay.
Yes.
I'm gonna, our office has created a little resource guide that has access to all of the infographics and videos that were created with the TPT Now project. And I've put the link in the chat of where to go for that. The landing page, has a little bit of background about the project, and then you'll see the table of contents on the right-hand side with some kind of high-level topics. And if you click on one, we'll say health and wellness. It will take you to kind of subtopics. So here we have, the eating healthy graphic. And if you click, you can download this graphic in the 4 different languages. Some topics, like Sydney mentioned, have multiple versions. So what is healthy living? There's 3 different infographics. And of course, they all come in the 4 different languages that you can download. There's also links to the videos. So here we have links where you can download the videos in the 4 languages. We will also be uploading the YouTube links from the TPT Now YouTube page as well. So we're excited to share access to all of these. So we hope that you guys can, find a topic that is relevant to your communities and download and share these out as much as you'd like.
Thank you. And I like the way too, Jacqueline had the idea of including.
Oh, we lost you, Darlene. I think she was mentioning that we also included a little bit of information on the side about, what is addiction, and then we have links to
Medline Plus on each of these pages. Pardon?
Oh, you cut out a little bit, Darlene.
Oh, I am. I apologize. My internet seems to be unstable. But thank you. Yes, he mentioned the Medline Plus. Are you able to hear me now?
Yes, perfect. Thank you.
Okay, good. Well, let's do some Q&A. If you lose me again, Miles, I know you're there. We would love to have your questions. Are people able to unmute, or will they just need to put their questions in the chat box?
Yeah, if you could just put them in the chat box, we can read them out loud.
Great. Any questions for our presenters? Well, I would like to know, while we're waiting for some questions to come in, I think you've touched upon many of these things, but Jeff, how many other health systems out there do you think are producing patient education materials at the volume that your organization does? Are there any others out there?
Well, I'm sure, hospital systems, around the country are doing, the same thing. They're doing it individually, right? If you have a hospital system, in a certain state, in a certain city that is trying to meet the needs of the clinicians within its system. I don't know of any other communities where the hospitals come together to try to meet the needs collectively. But I'm sure that every hospital system around the country is doing this. But with limited funds, it's almost impossible to truly meet the needs of the communities in the languages that are needed. So there is a lot of efficiency when folks collaborate and do it collectively versus systems trying to do this individually.
Lillian, you raised your hand. Did you have a comment?
Oh, Jeff, I can't wait to take you out for coffee. You just said a giant. So that's actually part of what we're trying to do as a public media entity, is trying to collaborate. But what that means is exactly what Jeff said. Trying to collaborate in a competitive environment when there is not enough funds to go around is really hard. You have in hospitals, and here in Minnesota, I dare say we do a pretty good job of collaborating, but when it does come down to whether it's grant funding or other funding types, that's where the rubber hits the road. We've tried to, the other problem is systems. System alignment is not easy for major institutions like hospitals or even government agencies. It means everybody has to get on the same page. And our systems, I dare say some that may be a little outdated in this area, it's hard to align all of those systems. So that's the new work that I actually think is ahead of us. And I have appealed to some of our hospitals here in the Twin Cities. Hey, can we agree on some things that we could kind of share and benefit from? Shared content on the area of health and safety, like taking Jeff's content, for instance. We have a program a little bit similar here that is used, but it's a membership based only. So again, it comes down to how to keep it sustainable, because it takes somebody to operate the website, keep translations current, make sure as the information changes, it's current. I have the same problem. It's hard. Some of the major hospitals here in the Twin Cities are lucky. And I say lucky because, again, it's hard to keep them funded, but they have dedicated interpreter staff. Maybe not all languages are represented, but they have some staff. But those programs are often subject to cuts. Again, it's a tough issue. And I think we're catching up now. COVID actually really raised the flag for all healthcare. Healthcare already knew it long before us. But I think COVID got some public and I dare say political attention that may create new changes for systems and resources to support these vital initiatives. Everybody gets sick, right? Not just the dominant culture. Everybody gets sick. And so at some point we have to decide what the priorities are. So yeah, you kind of step up, I'll step down off my soapbox.
Thank you. Good point. We do have a question in the chat box from Michelle Bass, Pennsylvania Hospital. She says, Jeff, do all your hospitals use the same health education vendor? And then how do you decide which materials to make freely available versus maintaining in your own intranet or via your vendor?
I believe that the hospitals do have different vendors that they use for general health information. You have to remember my Mount Carmel Health System is a hospital within the Trinity system. Of course, OSU is part of us university. So the hospitals do have different vendors that they use for the general health education. A lot of the times materials that we are looking at here within our collaborative are those that at times fall outside of what their vendors produce. The vendors do a pretty good job, but it's limited in language. It's limited in the amount of titles available. So a lot of times, we're not looking to duplicate what those vendors do. But I do get my patient education representatives from each of the systems together quarterly, sometimes even more often than that, to say, what are you hearing? What are the main needs that folks are bringing to you? Are you sensing that there are some needs across systems? So that's really how we do that. I've got a go-to group that I convene at least quarterly. They share with each other. I've got quite a few requests out there for this need. Vendors not able to provide that to our hospital system. The other members agree, yeah, I've got some of that need myself, and so then we'll take the next step to add that to our volume. We don't want to duplicate. We really want to make sure that we're meeting the need of materials and titles that aren't in existence in languages that aren't that common. You can go to a lot of initiatives and you can see translations into Spanish, right, or into other primary languages. But here locally, we're becoming more diverse every year. So we're up to about 14, 15 languages. Are all those at the same level of Spanish? No, but they're in need. As was just stated, everybody gets sick, right? We have a need to communicate and educate everybody in our community. So it's a challenge. But that's kind of what my role is, to facilitate, bring folks together, saying, what are the needs that you're hearing about? Are those needs not being met by another resource? If so, let's move forward in meeting that need here locally.
Lillian, do you have anything you would like to?
I have to support Jeff again, and I'm sorry. I have a lot of passion for healthcare.
I love it.
I do. I have a lot of
coordination and collaboration going on right here, right
I know
now.
we are. But let me tell you about some of the things that are happening, what I like to call at the street level in hospitals. Imagine having your 8-year, these are stories that I've heard from my communities that I work at. Imagine having your 8-year-old child have to serve as the interpreter to a parent who's a severe diabetic, and as a result, they're going to need their leg amputated from the knee down. I've heard that conversation. Imagine being a woman who has been diagnosed with severe breast cancer, and the consult from the doctor is, the Western medicine doctor is, these are the things we need to get going right now, including surgery. But you have to first check in with your own community, your husband and your eldest son, before you can actually, and alternative medicine, before you can actually make a holistic decision about what strategy you're going to use to address breast cancer. These are the things that are really happening in our cultural communities. So some of it is a need for education, and then some of it really is a need to have some systemic things in place so that doctors and nurses can focus on treating patients and reduce some of these very delicate situations that happen in patient rooms. And here's the thing. There is technology out here. It is catching up. It's not perfect, but technology plays a role. Individuals and people play a role. Funding resources play a role. Policies play a role, and that's really the work that's ahead of us.
I have a question. Do either of you, Lillian, well, Jeff, you sit on boards with the hospitals, but Lillian, do you sit on boards with the hospitals?
I'm not retired yet, but I would love to help and continue to help hospitals. I am frequently, however, called on by some executive directors at different hospitals for different groups who are tackling in their own ways, just like Jeff's hospital is. How do we improve? I love the fact that he holds quarterly meetings with other health educators, because they're exchanging ideas, they're talking about strategies, they're addressing real problems when they pop up. There's a lot of places that aren't doing even that. And it's not because they don't want to, they don't value it, or they don't see the importance. Again, sometimes it's about priorities, policy, and resource.
Thank you. And since many of our members are affiliated with libraries, being health system librarians or public librarians, Any words of wisdom about how librarians could be more engaged with their health and their communities and their doctors and their hospitals and providers?
Librarians are the best. They're one of my favorite distributors. We used to reach out to a network of librarians. There are districts here in Minnesota that have district librarians. We used to back in the day. We don't offer, I'm going to really date myself now. We used to make DVD copies of all our programs, and public health nurses can carry them to their home visits, and libraries could store them and check them out for people that would use them. We're not doing that anymore. We don't need to because of fantastic technologies that we have. But libraries serve in a different way now for us. They're great gatherings places for engagement activities that can make the difference in script writing or distribution or getting buy-in to which topics to choose.
Thank
Well,
you.
and Darlene, I think that's the reason why I was so appreciative to get the opportunity to talk today. So as we have, librarians out there that, perhaps are, let's face it, I think folks still go to the library just looking for resources, looking for where can I go to answer my questions? And healthcare is a big part of that. So I just really appreciate the opportunity. We're a small organization, and while we do have a lot of users, I don't really have a marketing budget. Right. And so the more we're able to get the word out there that there are free resources available, we're not an exhaustive resource, but there are, I'm sure, a lot of folks out there that are looking for some kind of resources available in their native language to explain, what do I do after a procedure? How can I help deal with stress? What can I do during pregnancy? Some of those issues. And so just the opportunity to talk to folks who maybe have access to those folks, who are dealing with individuals who have those questions. Again, I'm just really happy to be able to present, just to give you one more tool to perhaps you can steer folks to help them.
Thank you, Jeff. We really appreciate that. We have a question again from Michelle from Pennsylvania Hospital. She wonders how many of the hospitals in your consortium have hospital librarians. Do you know that? Do you have that answer?
I don't. I don't. I actually have not, to be quite honest. I've never actually worked in a hospital. My former background was I was a lobbyist, and so I do know that I work with the patient education representatives, but I've not actually heard of hospital librarians. So I will be honest, that is actually a new term to me.
Lillian, did you want to answer that question as well?
I do not have an answer to that question either. I'm sorry. I do have an answer to Christopher's question in the chat.
Okay, please.
Community-based level. This is all community-based level. It's not, maybe it comes across individually based in terms of a one-to-one session using Jeff's materials or a one-to-one session using TPT Now's materials. But we keep a Rolodex of community leaders, and we work mostly with community agencies. Because there's two reasons why. One, they keep their own listserv, and I have to keep track of one agency that may keep track of hundreds of Asians here in the Twin Cities area. So that's one way that we can get a broad-based distribution of our content is through agency-based, culturally led, nonprofit or government organizations. That's a lot easier to keep track of too, especially maintaining Rolodexes and things like that.
Thank you. And I see that Missy Creed is with us today. Missy Creed is the hospital librarian at OSUMC, Ohio State University Medical Center. Hi, Missy. Thank you for participating today. And you do need to meet Missy, Jeff.
Yes, I do. I felt bad that I hadn't met Missy beforehand. Missy, not to put you on the spot, but do you have counterparts with the other hospital systems here in Central Ohio that work in the health librarian space?
And we probably do also through the network of the National Library of Medicine. And I will follow up with some of the names of those hospital librarians. And you actually can find that information. This is a plug by coming to nnlm.gov/membership. And you can access our members directory to see who is actively participating with our organization And they won't all be librarians because we have people that are public health professionals and other walks and professions, careers. And but it's a great resource for all of you to access, to find people that you would like to collaborate with. Thank you for putting the membership directory in the chat box. Great collaboration going strong here. Well, we have about 5 more minutes, and I do want to give another plug. Their projects, Jeff and Lillian's projects and Sydney's projects, were made available because of funding from our sponsoring agency, which is the National Library of Medicine, a part of NIH. So currently, we have been promoting our new subaward for our next performance period. We have been promoting this since, I think, February is when we announced it. But we have a Health Information Outreach Award that is available to anybody who wants to apply. If you share our mission and if your goals align with what we want to achieve, please think about applying. It's up to $15,000. Applications are due March 31st. So hopefully you already have some great ideas that you can submit, or you've already started to work on your project plan, and we'll have it ready to submit by or before March 31st. And so don't delay. Come to our website, nnlm.gov, funding, and you can learn, read more about the details for this award and apply. So many thanks to our 2 presenters. We really appreciate your time, your effort, your creativity, your passion for community outreach, and helping everybody get access to quality information. So if you attended today, we really appreciate it if you would take time to complete this online survey. And also, if you would like to get credit from Medical Library Association towards your consumer health information specialization, please use this code at the end of the evaluation. It is a long URL link, so Miles will put the URL probably into the chat box, but you can also use the QR code that you see here. If you have your phone available, take a snapshot of it.
Hey, Darlene.
URL. Yes.
Did you share your slides?
Oh, I'm not sharing. I apologize.
That's all right.
Here we go. There we go. That will help. So there's the QR code, and there is the link that is rather long, but I hope that Miles might be able to put that into the chat box, and the code to use to get your credit. So that's what we have for you today. I'll back up one more slide because you didn't see this as well, but this is the Health Information Outreach Award, up to $15,000, and apply by March 31st. So, do we have any other questions before we close today's presentation? Thank you very much for everybody attending. We appreciate your time, and we look forward to seeing you all again at our next Speaker Spotlight series. Have a great rest of the afternoon.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.